The most commonly used therapies, if you have chronic pain, aren't working. The pain is chronic, you're not getting better. Typically, procedures like surgery aren't very effective in that setting. You can use anti-inflammatories, things like Motrin, acetaminophen, Tylenol. A lot of people end up on opioids, and opioids are quite effective for acute short-term pain. But when you use them chronically, they have a lot of problems. Opioids for chronic pain lose their effectiveness over time, typically, and they have all the negative consequences of addiction and drowsiness and just side effects that really make them not good drugs for chronic pain. So we need something else. We're talking about people who really don't have anything often more to do. Their lives are horribly disrupted by this, and getting something that works a bit is valuable. And if one of these therapies doesn't work, it's possible that another one will, so you can try them in sequence. These are inexpensive therapies, by and large. They're much less expensive than many things that we think about doing for pain, often less expensive than medications. A lot of them only require a short course. No one has studied in a reasonable way whether these therapies reduce the use of opioids. It's something that is ripe for study. It would be great if funders funded trials to look at that question. It would be great if investigators looked at this, because it's a really important question to know the answer to. A lot of these therapies are often not covered very well by insurers, and that makes patients less likely to try them, and it also means there are often fewer providers around. It should be easy for providers to order these therapies. Right now, it's much easier for a doctor to prescribe an opioid than to prescribe acupuncture or cognitive behavioral therapy, and payers could make that easier to do, make it simple so that doctors will choose those things. These are very safe therapies, and we want them chosen. This is actually a big problem both for referrals and for the payers, for the insurers, is knowing who's an actual provider of this. It's pretty clear that we need expert societies, professional societies, to come up with ways of certifying people. Payers need to look at the evidence to decide how long a course of therapy they want to cover. They need to think about how many of these therapies they want to cover, and our recommendation is that they would cover all of them. That's because some patients respond to one but not another. Some may want to try them in sequence. Some may even want to try them in parallel, take them at the same time. And we think that there's enough value here that that's worth the insurers covering and allowing.